Hi, everyone. Thank you for joining us and attending today's Michael M. Davis e-lecture. The Center for Health Administration Studies attempts to highlight nationally renowned researchers and their projects in the hopes of continuing policy impact discussions and helping to improve health outcomes for vulnerable populations. In a moment, Dr. Colleen Grogan, the GFAP faculty director, a CHAS co-director and professor at the Crown Family School of Social Work, Policy, and Practice, will offer brief opening remarks and provide a more official introduction of today's presenter, Dr. Jamila Michener, an associate professor in the Department of Government at Cornell University. We will have the Zoom Q&A pane as well as the chat pane open for questions throughout the lecture. We will try to field them as quickly as possible. Hopefully there'll be a more robust discussion at the end following the presentation. Today's PowerPoint will be archived on the CHAS Lectures webpage, and a recording of this presentation will be on the CHAS YouTube channel. We are currently recording, and now Dr. Grogan will introduce today's lecture. Thank you.
Okay, great. Thanks so much, Keith. Welcome, everybody. I'm really excited to have Professor Jamila Michener here. She's actually, we could maybe call her one of our own. She received her doctorate here at the University of Chicago, of course, many years ago now, but I had the very, very good fortune of meeting Jamila. I'm not sure I met you as a doctoral student, but I met you when you were a postdoc at University of Michigan as a Robert Wood Johnson health policy scholar, and just been a huge fan ever since. So now, of course, Jamila has moved on and is an associate professor in the Department of Government. She's also, I was really pleased to see the co-director of the Cornell Center for Health Equity, which is super exciting. Her research focuses on poverty, racial inequality, and public policy in the United States. Her recent book, which I highly, highly recommend for everyone here in the audience, and hopefully some of you have already read it. The title is Fragmented Democracy, Medicaid, Federalism, and Unequal Politics. It examines how Medicaid affects democratic citizenship. Jamila focuses on the vantage point of those who are living near or at poverty, and unpacks how federalism transforms Medicaid beneficiaries' interpretations of government and structures their participation in politics. So it's a really, really interesting take on the politics of Medicaid. I learned a lot from reading the book, and always learned a lot from Jamila's work. She's also working on a new book, which I'm not sure if she'll be bringing in some of that work today, but the title of that book is Uncivil Democracy, Race, Poverty, and Civil Legal Inequality. I think Professor Michener also recently received a Robert Wood Johnson grant to look at health equity and Medicaid and WIC. So that's also very exciting to really bring Medicaid into the health equity lens. Of course, people have done that, but I know that Jamila will have a different take on that. And so I'm really excited about that. She, of course, has many other scholarly publications and academic journals. But also has contributed quite substantially to the popular press. For those of you who haven't seen her work in those venues, that's always a very good read as well. So with that, Jamila, thanks so much for joining us. I know you have a busy schedule, so I appreciate you still making it in on Zoom for us. So with that, I'll get you started. Oh, and I want to say, there will be people putting questions in the chat, but we can wait until the end and take all the questions at once. So don't feel like you have to respond as you're going.
Sounds good. Thank you so much, Colleen. I'm gonna work on sharing my slide here, but while I do that, I just want to just thank you for that introduction. I remember When I was a postdoc at the University of Michigan, I started to read your work, and probably because I was doing a postdoc at a school of public health, and there were all these people whose work I started to be exposed to because of my public health colleagues. And when I started reading your work, and then I realized you had been at the University of Chicago, I thought, why didn't I know this? I could have, could have had you on my dissertation committee. And so could have, would have, should have, but I'm grateful nonetheless that we have been able to engage these last several years, and I continue to be inspired by your work. So I really appreciate the introduction, and I appreciate everyone who's on today and the chance to be here. Certainly put your questions in the chat along the way, but I will confess that this is very much work in progress. It's not part of my ongoing book project. It's a kind of separate paper that I recently started. I think many of us are in this situation where we've been living through a pandemic, and we're social scientists and scholars, and we want to take the tools that we have as social scientists and bring them to bear on understanding the processes unfolding with this pandemic. For me, as someone who studies health policy and social policy, and someone who studies race and politics, I very much wanted to think about how all of those different phenomena were working together in the context of COVID-19. And this paper that I've been working on, which I'll be presenting, some of my progress thus far today, is really a reflection of a kind of desire to bring the tools that I have as a social scientist who studies the things that I study to bear on what was happening or what is happening with respect to COVID-19. And so we're still in the middle of that, obviously. And that means that necessarily this will be a work in progress. And so not only do I invite you to put questions in the chat, but I also in the Q&A rather, but I also invite you to offer suggestions, to point out things that perhaps I'm not thinking about that you think I should consider, and so on and so forth. I'm always on the fence about whether to present work in progress versus whether to present something that's shiny and polished and will make you look so smart. And I tend to fall on the side of presenting work in progress because I want that work to be better. And by engaging other people, it helps me to improve the research. So I really appreciate everyone who's watching today. And I'm keen on hearing your feedback and insights. So the story of COVID-19, in many ways, there are so many narratives embedded in the kind of larger phenomena of this pandemic. But in many ways, the story of COVID-19 is a story of racial inequity, right? We can think about this with respect to the numbers and just thinking, for example, about how much more likely people of color, Black, Indigenous, Latino populations are to die of COVID relative to their white counterparts, right? And certainly we can think about it in terms of what we experienced in 2020 with respect to racial uprisings and all manner of political contestation in the face of racial violence and racial inequality. And so, both the story of COVID-19 and in many ways the story of the moment that we're in now and that we've been in for an extended period of time is one of racial inequity. And one of the things that I try to emphasize, and I'm sure is a narrative that's familiar to many of the people who are on today, is that the health inequities that COVID makes plain and that COVID brings into sharp and striking relief are institutional. They're rooted in institutions, right? And it's funny, I've had to explain this from everyone to like my small children to, my nieces and nephews, to like ordinary people out in the world, to my students, and so on and so forth, because it's not something that we sort of necessarily naturally understand. It's easy to look at differences in terms of health outcomes with respect to groups. And if you don't have the proper context, to think those differences have something to do with biology or genetics or behavioral choices. And what I emphasize for people is that much of the explanation, in fact, when we try to understand why are Black and Latino and Native populations so disproportionately affected by COVID-19, much of the explanation lies in institutions, right? And if we think about the World Health Organization's definition of the social determinants of health, right, which is the language of social determinants and the lens of social determinants, is one that I have found at least, has been increasingly drawn on to try to help us grapple with and make sense of the patterns that have unfolded in the wake of COVID-19. And the World Health Organization says it's about where you're born, where you grow, where you live, where you work, where you age. Of course, all of these things are associated with various institutions, whether it's the labor market, the healthcare system, institutions like, prisons, neighborhoods, right? And, the other thing that the World Health Organization points out is that social determinants of health are about the distribution of money, power, and resources, right? And so one of the things that I want to do today is think both about institutions and the role that they play with respect to health inequities, specifically in relation to COVID-19, and about power, right? And about power. And I think one of the reasons why the World Health Organization definition of social determinants of health is probably my favorite, is because it explicitly names power. And perhaps because I'm a political scientist, or perhaps just because of my general orientation, I always want to think about inequity, racial inequity in particular, in the context of power. What it helps us to do is sort of denaturalize racial inequity, right? It's not about any kind of natural or inherent characteristics that some groups have relative to others, but instead it's about dynamics of power. And power is rooted, in fact, in institutions. And public policy is a key institution, and we may not always think about public policy as an institution, but there is, a kind of a group of political scientists that really make this argument. And I think many people and many of us intuitively know this, that if we want to think about the institutional roots of health equity, we need to be thinking about policy. And in many ways, policy is sort of a gateway institution because it shapes so many of the other institutions that I mentioned. If we think about the composition of and dynamics of neighborhoods, if we think about the carceral state and prisons, if we think about the labor market and employment, so many of the other aspects that we understand to be related to social determinants of health and to be shaping core institutions are funneled through and affected and structured by public policy, right? And of course, we've seen public policy making in the context of COVID-19, perhaps to an extent we haven't seen, arguably to an extent we haven't seen in a long time, right? Something like the CARES Act and the massive federal expenditure that it represents wouldn't have really been possible outside of the kind of harsh realities of COVID-19. And that's just on the federal level. On the state level, there's so much more going on, right? Thousands of bills across the states and territories in the US. And so we have COVID-19, but there's this huge policy response to it, right? And of course, the policy response is unfolding in the context of a set of political systems and institutions that already exist. One political reality that shapes the policy response to COVID is the massive fragmentation that we have in our policymaking system in this country because of federalism, right? Now, if you take a favorite policy of mine, because I pay a lot of attention to and spend a lot of time with Medicaid, it's a kind of prime example of how states make decisions that are quite different across states, but that have really market implications for the people who live in those states, right? And so state policy responses to COVID are crucial, particularly in the US, because of how fragmented our political system is. And a lot of the onus lies on states to decide how to respond to COVID, how to meet the emerging needs that are becoming clear among their residents, right? And so in a context where federalism is key, and there's a huge pandemic that requires a response, states are going to be major actors, right? And one thing to keep in mind is that state policy decisions are racialized. What does this mean? This is just a graph that shows the racial composition of Medicaid beneficiaries across states. But racial, and often I find there's misinterpretation when I say that state policy decisions are racialized, and people hear that in many different ways. And one way to hear it is, that's like, you're saying all state policies are racist, right? I'm not, right? But what I mean when I say it's racialized is that these decisions, for a variety of reasons, have racial meaning and consequences and implications, right? The reasons may be because of the composition of the population, the populations that are affected. So here's the example here of Medicaid beneficiaries. It's when we're in a kind of position where in half of the states in the country, over 50% of Medicaid beneficiaries are people of color. It's difficult to not think of Medicaid as a policy that has racial meaning and racial implications, that is racialized, right? Now, whether a particular policy intervention around Medicaid is quote unquote racist, the devil is in the details there. But what we know is that policies around, something like Medicaid, but also other social policies, they carry a weight with respect to race. And so when we're thinking about the kind of political world that these policies exist within, we also have to be cognizant of racial processes in politics, right? Because our larger political process, and I don't know that this is something I have to argue. I think that it's something that we've witnessed over and again, and something that is, very much sort of clear in our world, which is that our larger political process is racialized, right? Everything from the way that we understand the pandemic, the levels of vulnerability that Americans think they have to it, to their assessments of how the government is responding to it, and beyond, right? Almost every aspect of this pandemic that we can think of, from the perspective of ordinary Americans who we asked to evaluate various aspects of it, to the perspective of the policies that are passed in relation to it, those things are part of a larger political process that has racial meaning and racial implications, right? It is racialized. So this is just one example, right? Most Black adults who are Democrats say that the government pandemic response would be stronger if white people were affected. And this is just one way of kind of showing how the relationships between, the pandemic and the politics surrounding it are part and parcel of how people understand, how they experience, and how they make sense of race, right? So my goal, just with the research that I'm going to tell you about in just a second, is to understand COVID policy responses, the way that states responded to the challenges presented by COVID, particularly the kind of economic challenges presented by COVID. To understand that in the context of larger racial dynamics, particularly racial dynamics around power and politics, right? My core intuition here, and I don't even want to say anything as strong as hypothesis, right? Because I'm still really thinking through this and figuring it out. But my core intuition is that given the relationships as we understand them between social policy and racial inequality, and given the kind of decentralized pandemic response that is part and parcel of our kind of federated polity, a comprehensive assessment of state responses to COVID-19 has to account for race, right? We have to be thinking about race, racism, and racial power dynamics if we want to understand in the kind of fullest sense how states are responding to the pandemic and why, right? This is my core intuition. And just to clarify, when I say given the relationships between social policy and racial inequality, it's important to maybe concretize that a bit with some examples. Much of what we know as social scientists who study poverty is that social policies are in many ways affected by racial dynamics. So policies like Medicaid, policies like TANF, temporary assistance for needy families, and other cash assistance policies, and I could continue to name policy domains, there is a relationship between the generosity of these policies the likelihood of expansions or reforms, and the likelihood of the policies even existing and being in place in particular states. There's a relationship between those outcomes and racial dynamics. And by racial dynamics, I mean a range of things. It could be the racial population of state residents. It could be the racial composition of state residents, the racial composition of the people who benefit from the policy, right? Or the kind of racial political dynamics in the political institutions in a given state, in the House, in the legislature, what have you. So there are these relationships, and a range of them that social scientists have identified between social policies and racial inequality. And so we know that those things are connected in the pre-COVID world. We have evidence that those things are consistently, not always and everywhere forever, but consistently, right, and systemically connected in the pre-COVID world. So if we now want to understand what social policy dynamics are looking like in the COVID world, right, and how social policy responses are unfolding in relation to COVID, we have every reason to also believe that race might matter. And so what I want to try to understand is the extent to which and the ways in which it does. So to do this, I focus on 4 policy arenas, and I will likely fold in some more policy arenas as this research progresses, but for now I'm focusing on 4. One is housing, and I think here about outcomes like whether states initiate eviction moratoria, whether they decide to close courts, whether they decide to implement other policies that are meant to benefit, for example, either homeowners by like freezing foreclosures, or renters by saying that landlords can need to use the security deposit to cover existing debts that renters may owe them. States have taken a wide range of actions to try to deal with the fact that the pandemic has accelerated and exacerbated a housing crisis, right? Especially around evictions. And so I have collected data both from a variety of data sources. Boston University has a great COVID policy database, and some of my own data that I've supplemented this with to try to understand what states have done in the wake of COVID about housing and in relation to housing needs. And so I have systematic information about that on the state level. Similarly with health, whether states, for example, decided to open and extend enrollment periods so that people could enroll in healthcare plans and have health insurance, whether states decided to expand eligibility for various categories of people for programs like Medicaid. So, you know, folks who have to quarantine, folks who are taking care of disabled or elderly parents or children or what have you. There are whole categories of people that states have decided, okay, we're in a pandemic, we want to make sure these folks are covered, we're going to expand eligibility. And a range of different actions that states have taken to try to adjust their policies in relation to what's happening with COVID-19. So I also collect systematic data on state policy responses in the realm of health. Similarly with utilities, and this is mostly about utility shutoff freezes. So when states say, wait a minute, no shutting off the electricity, the heat, the gas, the water during a pandemic if people don't pay their bills, right? So charting systematically whether states initiated through legislation those kinds of freezes, right? And then income support, and this is largely focused on changes in unemployment insurance and whether there were policy changes made with respect to unemployment insurance that made it more accessible for people, that allowed them to have access to it for longer, or that increased the generosity of the level of unemployment insurance, right? So some of these things are dictated also at the federal level, but I am focused on what states are doing over and above whatever the federal baseline is in the arenas of housing, health, utilities, and income support with respect to policy that's directly meant as a response to COVID-19, right? I also focus on race and power. And in part, I want to understand the relationship between those policy outcomes that I showed on the previous slide and dynamics of race and power in the state. How do I operationalize this? You know, power is not an easy thing to operationalize, and it's never quite good enough, even in my view. But some of the things I consider are the racial composition of state residents, just how many of the kind of ostensible constituents, how many people in the state are people of color. The racial composition of state legislatures, in other words, how many members of the state legislature, or what proportion of members of the state legislature in a given state are Black, are Latinx, are Asian American or Pacific Islander, and so on and so forth, right? And the logic here is that, you know, if there are more residents in the state that are people of color, then policymakers perhaps are going to be more inclined to respond to these potential constituents. And if there are more members of the state legislature that are people of color, then similarly, there may be a kind of substantive representation there. It's possible that it's this mostly descriptive representation and it doesn't translate into substantive policy outcomes, but it's also possible that there can be a substantive representation there that means that we're going to see state legislatures that are themselves more diverse, initiating more policy that is responsive to the level of need expressed in the context of the pandemic. I also consider the voting power of people of color, and that really includes thinking about the kind of the share of voters in the previous election. So this is 2018 then, that were Black, that were Latinx, that were Asian American, and so on and so forth, right? So this is not just about, it's dynamic. So it's not just, do people of color exist in the state and how many exist, right? But how are they integrated into processes that relate to politics and power, whether it's voting from the standpoint of the populace or decision-making from the standpoint of members of the legislature. And then I have this in red because this isn't incorporated in my data yet, but it's a variable I've begun to collect data on and almost have finished, which is the level of protest against racism that occurred in the state in the wake of, in 2020 more generally, right? And the idea here is that protest is another way of exhibiting or demonstrating power, and that perhaps state legislatures and state policymakers are not only going to respond to the demographic constituent or composition of state residents, and they're not only going to respond based on their own racial composition, and not only going to respond based on the electoral power of people of color, but may also be moved by demonstrations of people power, right, in the form of protest. So that again isn't in the kind of analyses I'm going to talk about right now, but it's something that's sort of on my radar, so I wanted to point it out. So I'm going to talk you through the basic findings. There are a bunch of models underlying these basic findings, but I didn't want to put a bunch of tables with numbers up for you. And so I decided to mainly just talk through the findings, especially because they're pretty straightforward, more straightforward than perhaps I anticipated, right? All of those racial political variables that I just narrated on the previous slide are uncorrelated with policy outcomes in the various policy arenas that I outlined: housing, utilities, health, and unemployment insurance. Either individually, meaning if I look at the relationship between housing policy outcomes and racial political dynamics in a state, between utility policy outcomes and racial political dynamics in a state, so on and so forth, or as a composite, if I create a composite variable that captures what is happening across all four areas, and that is my outcome of interest, right? Now, this is based on very straightforward OLS regression, which is why I'm saying correlation, right? And it's important to keep in mind, this is cross-sectional observational data, right? And part of that is a function of the fact that it's about things that happen, that are happening now, or that happen in one point in time, right? I don't have longitudinal data about state policy responses to COVID-19 because COVID-19 has only been going on for the past year. And so that's a major and important data limitation, right? But I still want to try to understand, notwithstanding that limitation, whether there's an indication of these factors and the extent to which there's an indication of these factors being correlated. And so that is kind of the kind of logic and intuition behind this analysis, notwithstanding the more sophisticated analysis approaches that we might want to think about to in response to questions like these. I started with this project, and I've already admitted that it's a work in progress. I started with the most basic question. Do we see correlations in the data in a basic regression that looks at the relationship between the racial political variables that I narrated and the policy outcomes that I described? And this is controlling for partisanship, in particular, the partisanship of the governor and of the state legislatures, both chambers, and controlling for the unemployment rate and poverty. So the models are pretty sparse. They don't have a whole bunch of variables in them, in part because the logic of the unemployment rate and poverty is that those things are a reflection of need. And maybe states are just straight up responding to need. And the kind of racial dynamics aren't coming into play as much in the context of a pandemic when you need to respond quickly to people's needs, right? And so I wanted to account for need, right? And to a certain extent, capacity in a state. So I have those very basic variables of the unemployment rate, marked at the unemployment rate right just before the pandemic began in 2019, just before the pandemic began. And then the poverty rate, similarly, in terms of the time period. And I want to understand those to reflect that kind of underlying dimension of need. And then, given that those things are controlled for along with the partisanship variables, do we see correlations between racial political variables and policy outcomes, right? And the answer, as far as the analyses that I've run thus far, is no. Those things do not appear to be correlated. The only consistent relevant political variable is partisanship in terms of the legislature and the governor, and which comes into play depends on the specific model and outcome, but that is consistently significant with respect to the correlations that I'm observing. But the most consistent and strongest correlations throughout the models, not just the political variables, but throughout, are with these markers of what we might understand as need, state unemployment, and poverty rates, right? And so how I'm thinking about these findings, these preliminary findings thus far is this way. First of all, obviously the data is limited. And so I want to sort of think creatively about how I might try to assess the relationships between social policy and racial dynamics in ways that either take advantage of differences in terms of timing with respect to rollout, or some kind of exogenous shock, although COVID is the ultimate exogenous shock that everyone's experiencing at the same time. So it's a little difficult. But I'm thinking through how to kind of take a different approach with respect to the data analysis. But I always still find there's a value in just understanding data descriptively and in terms of correlations and in terms of the data that we do have access to. And so I think that this is, for me, this has been a valuable exercise. And it wasn't necessarily what I expected going in. I think what I expected going in was consistent with what I had seen in much of the literature around social policy and racial dynamics previously, which is that racial dynamics really do shape the contours of social policy outcomes, right? Partisanship dominates all else, and this isn't a surprise. In a lot of models that are looking at determinants of social policy, partisanship comes up as significant. And one difficulty is we may think that partisanship and race are sort of super closely connected. You know, the partisanship variables I have are not highly correlated with the racial political variables that I have. So just in terms of the empirical analysis of correlations, there doesn't seem to be multicollinearity or something like that going on. But even conceptually, right? Partisanship and race are in many ways mutually constitutive in our politics. And maybe that is not just an empirical problem, but it reflects a way that we might have to think about the role of racial political dynamics and the mechanisms through which they operate. And then one explanation is that racial dynamics are less central in the context of acute need. When state policymakers have to respond quickly and when they have to respond to striking and acute needs, perhaps they're able to work together and they're able to make things happen that in ways that are not as hampered by the normal sort of dynamics, racial dynamics of politics, just because of how striking the need is, right? And I have some ideas about how I might assess whether that's part of what's going on here. But that's, those are just some lenses through which I'm understanding kind of the preliminary findings of this preliminary work, right? But overall, and I'm wrapping up here and looking forward to questions, my point was really to think about the policy responses on the state level to COVID-19 through the lens of politics, power, and race, right? And COVID-19 as a health phenomenon and one that has highlighted massive health inequities helps us to think about the social determinants of health in, I think, a clearer and more striking way than perhaps many people were before. But what I say is that when we think about the social determinants of health, we always have to be thinking about institutions, and policy represents a core institution. And we always have to be thinking about power, which structures and shapes policy. And so if we want to understand racial dynamics, we have to think about them in the context of those things. But there's some, reason to believe, or suggestive evidence here, that racial dynamics in the context of a pandemic don't operate in the same ways that we might expect relative to what we've seen and how we've seen them operating previously. And so this has given me a lot to think of, and I'm thinking now about how to build out this research. And I'm looking forward to hearing from the audience and anyone who may have questions, or even better than questions, are answers. Give me the answers. I will happily accept them, at the very least, suggestions.
Thanks so much, Jamila. That was really, really interesting. And it's exciting to think about the database you already have developed, but still developing around all the COVID policies, the response across the 50 states, and as well as new data on racial protests. So it looks like we have a number of people asking questions in the chat. I thought I would start out with a few, and then we will definitely go to the questions in the chat as well. This is really interesting work. I mean, as you know, I've for a long time have thought about sort of what are the state factors that impact health policy in particular, not the other policy domains that you're looking at. So I love it when when people are looking across domains. I think that's really interesting. I really like that you're doing that. That we have housing, health, utility, and income support. That's really powerful. So it's, I guess one reaction is so many people, as you said, have found, especially in more recent years, that when they're trying to look at these state level policies in almost any domain, partisanship just blows everything else out of the water. And especially when, like you said, you have a cross section. So I assume you're like dealing with the N is like 50 states, is that right? So I mean, so that's part of it. And I know you've said that right from the outset, that there's just like, you don't have a whole lot of, you just don't have a huge data set here to have degrees of freedom to deal with. But so that's really consistent with what I've been seeing just in general. So that doesn't surprise me. And I know it didn't surprise you either. I have seen more recent work as well that have, looked at unemployment and poverty as measures of need. And so I think that's really consistent. I guess one reaction I have to that is, is responding to need actually so new? Or don't we find this in other studies? Like to say during a pandemic, we respond to acute need. but we don't otherwise. I think some of the previous state level policy studies often find that those need variables are actually significant. Now, on top of it, they'll find that race is also significant. So I think obviously that's the new part that you're not finding. One thing in a study that I think you're aware of that Ethan Park and I did is if we looked at racial composition, and I know you have several racial variables, so it's not just it's not just the composition of residents that you're looking at other ones as well. But I wondered, we did an interaction with public opinion of racial resentment, and it was the interaction that made it significant. So that in a state, if there were high levels of racial resentment, interacted with also a high composition of people of color, then states tended to be less generous. So just throw that out there as a possibility of kind of getting at, it's not, because sometimes just the composition of people of color it's also interacted with need, right? Yeah. And it allows you to get at the kind of racial resentment aspect. So I wanted you to respond to that, but then I had one other thing I wanted to throw into the mix, which is, because some things, what's interesting to me is utilities. I wonder to what extent states are providing subsidies in these policies. So how much are state expenditures at stake when they're making these decisions versus a kind of short-term regulatory decision? Or in the case of housing in a number of states, they kind of put the onus on landlords. So it's not easy, there's always a political cost, but from a state budgetary perspective, I wondered if you could distinguish between policies where there's expenditures at stake versus policies where it's more of a regulatory decision. So I'll stop there and let you respond and then pull in some other questions.
Sounds good. Wow, I've been taking notes feverishly, and this is exactly what I hoped for, which is great ideas. I think the idea of, or the suggestion of interacting racial composition with racial resentment is a great suggestion. And I actually remember reading that paper and thinking, this is a great idea. So, I think that's a really good suggestion. And I think you're right. What racial resentment does is it brings in like more of the texture of the political dynamics in the state, right? So that it's not this passive, like, are there people of color existing in the borders? And it's more this active, like, what is the actual texture of dynamics between these different racial groups? So I really like that even in principle, because what it suggests is that it's about a politics of race, right? And not just about like demographic composition. Mm-hmm. So that's a great suggestion. It's something that I can readily and will readily do. I think that the question of state expenditures versus regulation, I hadn't thought about it that way at all. Although I will say I've been expanding the policy database, and so it's not finished yet. And most of what I have right now are the regulations, right? Halt on moratorium on evictions, or a freeze on utility shutoffs. Although in the arena of housing, there's a little bit more as far as it's going to, the expansions as far as, expanding eligibility for Medicaid or for the marketplace or what have you, and even open enrollment periods, staying open longer. Those things imply expenditures on the state's parts. But I really like this distinction. And it's easy enough to go back and code, like whether this is something that's regulatory or whether it's something that will come with some level of expenditure that the state should expect that it would. And that's a great idea. It may be that we see states, less willing to respond in some way, or, even less responsive to need, interacted with or not with race in the context where they're going to be carrying the weight, right, of the decision. So I think that's great. I think what you said about need is just right. Like need is not, it's not surprising to see states responding to need. It's actually heartening, especially given the kind of the acute level of the need in the context of COVID. But usually that doesn't foreclose the role of racial dynamics. And so to see that in this case, like the response to need seems to be different in the sense that it's almost irrespective of race. So that's interesting. And yeah, the dominant partisanship dominating in the context of my approach here is not surprising at all. One of the things that I'm doing, and this is where I think descriptive data can just be really valuable. So one of the things that I'm doing is identifying the states that seem to do the most as far as responses, the states that seem to do the least, and the states in the middle, and digging in, and doing some case studies with one from each category to see when we actually look under the hood, what does it look like in a kind of qualitative sense, right? And that helps us to know, okay, it's all partisanship, but what does that actually look like on the ground? Because partisanship can really be standing in often for various parts of the political process that are in fact very racialized, but that come across as just, it's partisanship, right? And so some kind of deeper digging I hope is going to kind of complement this very descriptive, overall bird's eye look at what's going on across all states with a more rich qualitative descriptive account. So that's what I'm working on now. And it's precisely in response to, of course, partisanship is going to soak everything up, but there has to be more to it than that. I don't know what the more is, right? So I don't project what that consists of, but I want to see those details on the ground.
Yeah, that's exciting. I'm glad you're doing a qualitative component to it, because I agree that, especially with just a cross section, there's only so much you can do. And so the qualitative will be really, really rich. And even if you had a longitudinal, the qualitative will still be really rich. But I could talk to you all day, but I will let other people come in here. So let's see what question we have. I said Evan Freund has a couple here, I think. Let's see. Another fruitful area of racialized public policy is criminal justice policy, legalization of drugs, average sentences, clemency and parole, releases, and sentences by race. And then he writes, certainly established access to primary care for men is better in states that have extended Medicaid, do mortality rates. So, I mean, I think what he's getting at is, kind of what I'm reading into this is there are so many different policy domains. And so I suppose one comment is, well, why not bring incarceration kind of issues like that into the mix as well? And I don't know if you have any thoughts to also the other aspects of Medicaid that you could look at.
Yeah, this is good. And I have actually started to collect some data on the carceral policy responses. I just haven't finished collecting it, so I didn't include it here. But one of the ways that I thought about that conceptually, I really started with the focus on the policy arenas that I thought were going to be most concretely connected to people's sort of material survival. It's a pandemic, you need healthcare, you need your utilities, you need, you need some place to live. And so I started with those, and you need income. So that's the unemployment piece. I started with the kind of facets of material, concrete material survival that I thought were most crucial, because I thought these are the arenas where states really need to be acting quickly, and seeing what they do with respect to these arenas is really going to tell us a lot about how they're responding to the pandemic. But increasingly, I've been thinking about the criminal legal policies as an interesting and important potential counterpoint. One of the things I was not surprised by, but I observed with these policy domains is that when I run the model separately for each domain, the determinants look essentially the same, right? And that made me wonder whether I might see something different with respect to criminal legal policy, both because it's a population that in many ways isn't as salient. They're locked up behind bars. And we've heard a lot about, prisons as kind of COVID hotspots and what have you. But for many people, that's not you can imagine legislatures not thinking that concern about people in prison and COVID is what's driving, voting decisions and other. So you can imagine that not factoring in as centrally to the policy or to the kind of calculus that legislators are making. And maybe that's where we'll see the racial dynamics really mattering, right? And so that's one policy arena that I'm going to fold in. Of course, like for each additional policy arena I fold in, there are more that I could fold in. And so there's both a logic of inclusion, and then there's just the practical, I can't include everything. But certainly with Medicaid specifically, I also am trying to account for more aspects of the health and Medicaid policy response. So what I have thus far is not at all exhaustive. So it's a little bit of a bottomless pit, right? So at some point you're just like, these are all the policies I got data on, I'm stopping. But it's also important to think about, well, what's missing and why, and how does that structure the nature of the findings, right? So I appreciate that question.
Yeah. Let's see, in the Q&A we have some questions. Mara Hennigan asks, in this work, do you expect to look at the local level rather than the state level? For example, in Illinois, some important housing policies are happening at the county level, given how the court system is structured. Similarly, rental assistance is also happening at the local level, given how the CARES funding is allocated.
Yeah, so I would love to look at the local level. And what I've been considering is doing a local level version of this for just one policy arena. I don't know which one yet, but, and the reason for that limitation is just because local level policies proliferate so much. I mean, if I decide I'm gonna focus on counties, that's 3,000 plus counties. If I decide I'm gonna go to an even smaller unit than counties, it ticks up and up and up. And the challenge there is finding the data sources to populate the database in a way that's systematic and consistent. And that could, depending on the level of analysis, could literally take years, right? And so I started at the state level, but I think you're absolutely right. In particular, when it comes to housing, there's so much, and a lot of the action is at the local level with housing in a way that's not exactly the same with health, and certainly not with unemployment insurance, and to a lesser extent with utility shutoffs. And so I think with housing in particular, if I were gonna peel out a piece of this to really build a local policy database, it would be housing. And ideally, I would do that in collaboration with a number of other scholars.
Yeah, that seems the time to collaborate.
Exactly. So if you're interested in that question and you have any resources for collaboration, reach out, because I would love to look at local dynamics.
Yeah. Okay, we have another question from Adriana Jennings. Do you think the vaccine being pushed to Black and Brown communities is intentional?
I don't. So there's a couple different ways I can interpret that question. One is there's been quite a bit of discussion, especially in the last few weeks, about how Black and Brown communities are not getting as much vaccination, right? They're not being vaccinated as high rates as other communities. So it could be that is the question. But then there's a whole and I think a pretty extensive kind of social media, and across the board government, in many local governments, departments of public health, there's an extensive push to try to convince, in particular, Black people, that the vaccine is safe, that they can and should take it. And both of those things are happening at the same time, right? We see both the kind of outcome or the dynamic of Black communities being sort of under-vaccinated relative to white communities, especially given their disproportionate exposure to the virus. And we see a massive campaign to try to convince Black folks to vaccinate. In many ways, both of those make sense. The campaign to convince Black folks to vaccinate is because early survey data showed that they were very skeptical of the vaccine for reasons that are perfectly logical and make a lot of sense. And there is a history of honestly abuse and trauma in Black communities vis-a-vis the government more generally, and medical discrimination and racism more specifically, that makes the kind of misgivings of Black Americans very sensible and logical. And I think the campaign was really around trying to address that and make sure that Black people were going to be willing to vaccinate. I'm not sure yet about the kind of causes and consequences of under-vaccination in communities of color, but I would imagine they're bound up in a lot of these social determinants that that I was talking about and that many of us have been thinking and talking about. And also in the dynamics of who can drop everything and make their way to a vaccine site, right? Like I've had, colleagues who are driving hours, 6, 7, 8 hours to go somewhere where they can, in the state where they can get a vaccine. You can take a day off. You can devote that whole day to finding your way to a vaccine site. You can spend the money on the gas, et cetera, et cetera. So the dynamics of who is going to be able to get themselves to a vaccine site and get themselves access, they co-occur with, or they co-vary with race and class, right? Which of course are very much related to one another. So it's not surprising that communities of color are being under-vaccinated. And then when you add to that, that they're doubtful and that they're more likely to be hesitant, although the degree of hesitation has declined. Surveys show more Black people expressing willingness to be vaccinated. I've seen this in my own family. My brother started off like, no way, nobody in the family should get this. They want to poison all of us. And is now, just last week, my mother was vaccinated and my brother was okay with it. And so I think some of the public campaigns have been effective in convincing Black Americans that it's safe to be vaccinated. But that doesn't change the structural barriers to them actually being able to be vaccinated, right? So I hope that somewhere in there I answered the question.
Yeah, definitely. I think you did. There's a question here from David Pate. He says, I'm interested in a gender analysis paired with your racial analysis as it relates to the generosity of the social welfare system. Do you have any thoughts on this? Our current social welfare system leans to mother and children or parent and child, and this is done for good reasons, but I'm wondering, these services are limited when you add gender to the analysis as well.
David, thank you for that question. And hi, David. Thanks for being here today. You're awesome. That's a great question. And I think about a gender analysis in 2 different ways, and I'll try to be quick. One is I actually have a piece out in the Washington Post in the Monkey Cage today that's about a kind of intersectional perspective on policy responses to COVID. And that piece, though, is really focusing on women and making the case that they have women of color, Black and Latina women, face a kind of unique constellation of acute disadvantages in the context of a COVID economy. And the case that we make in that piece is that policy needs to recognize that and in many ways respond to it in order to address those vulnerabilities. So that's really a gender analysis, but it's focused on the particular positioning of women. I think of women of color. I think a broader gender analysis, though, thinks also about what's happening with men and women, right? And this is where, for example, the suggestion earlier of bringing in the carceral policies might be really useful, because often those policies are gendered in a way that makes them very much associated with men, right? And some of that is for good reason, although of course women are affected by the carceral state as well. And it would be interesting to see if there are different dynamics in that space, and if there are, to try to think through to what extent does that have to do with the fact that women and children are not as strongly foregrounded in that policy arena, right? And similarly, thinking through policy arenas with respect to kind of their connotations in relation to gender, that might actually be a way to help me think through inclusion and exclusion of different policy arenas, because it gives me a little bit of a vantage point for at least considering the role that gender might play here. It's a great question, David.
Absolutely, yeah. Let's see, we have another question from, or not another, we have a question from Harold, Harold Pollack. He says, to me, a group's power and status are often revealed through the sense of urgency with which legislators and other political actors respond to clear threats to that group's well-being. If you ask politicians what they thought, for example, about lead paint in the water in Flint, Michigan, they were definitely sad that kids were exposed to lead in their young years. Nobody was happy that this was happening. It was not an unavoidable top priority issue. I can't help thinking that if there were gluten in the water in Grosse Pointe or Ann Arbor, their state legislators would have regarded that as an immediate political emergency. It is not so much racial antipathy or resentment, but a pragmatic sense of impunity. Many legislators were thinking, quote, or colon, this is not my constituents. I won't lose my job or fail to accomplish my own most important goals if I delay in providing an effective response to this problem. That sense of impunity towards essential workers exposed to COVID, et cetera, is a fundamental vulnerability.
Yeah, Harold, no need to apologize for the wordiness of the question. By the way, hi, Harold. Thank you for being here. It is a long question, but it's also very well thought out, and I think very important. So I appreciate it. And I think this is a tough one. You know, my initial reaction to this is absolutely, right? There's a different sense of urgency depending on who the constituency is and the level of kind of responsibility to that constituency that legislators have. And that's one of the reasons why I wanted to include in the data some marker of like the kind of racial identification of policymakers, of state legislators, because I thought, well, maybe Black and brown state legislators will have that sense of urgency because their constituents are more likely to be people of color, and we'll see that factoring in, right? That didn't happen, and that may be because, and I realized this when I was collecting the data, that there's such a small fraction of legislators in most states, right? And one of the things I'm going to do with the case study approach is I do want to focus on a state that has a really significant fraction of legislators of color and get a deep look at like what those dynamics are to see what does the response look like when you don't have that impunity and when you do have that urgency because your constituents are the ones dying, right? And so that's something that I'm grappling with. I'll say one more thing that's even more broad than this. When you say, Harold, you know, it's not so much racial antipathy or racial resentment, right? But it may be this sense of impunity. I have two immediate reactions to this, which is one, that sense of impunity may very well be a reflection of or a function of some level of racial antipathy or resentment, right? When I am indifferent to your death, to your pain, to your life-altering like medical trauma, like, I mean, it's not innocent, right? It's not like, oh, I don't have antipathy. I just don't respond as much to your pain as I do to someone else's pain. Well, I don't know if that's antipathy. I don't know if it's resentment, but I know it's something, right? And it's on par with either of those. So there's a part of me that like isn't interested per se in parsing, is it resentment? Is it antipathy? Is it this other thing that just gives you a fuzzy like indifference? I don't know. All of those things are a similar kind. I don't want to kind of like flatten important differences conceptually here. But at the end of the day, they're a similar kind of thing in that they're a kind of thing that leads to an under response to Black and brown and other people of color's pain and suffering, right? That's not an under response that I'm picking up on readily in this data. But to the extent that, and in the cases where that kind of under response or inadequate response exists and is correlated with racial dynamics, it doesn't much matter to me what we call it or what the underlying psychological processes are. What matters to me is that people of color are suffering as a result. That might be because like I'm a policy scholar who thinks about institutions and not like psychological processes. I'm not saying that those psychological processes aren't important, but there's a way in which I'm like, I don't know, is it impunity? Is it resentment? Is it, I don't know exactly what to call it. But that, what you just pointed out, Harold, like there's just a fuzzy like indifference to pain when it's others who aren't your immediate constituents. And many of those others are also Black and brown, et cetera. That is part of what I expected to be going on here. And it's a huge problem to the extent that it goes on and in the places where it goes on, right?
So I don't see another question, but I have one. Maybe I'm wrong, maybe some came in. A paper that I've been working on looks at how how the federal government structured the provider relief funds to primarily looking at, how they gave hospitals money across the country. And I kind of tried to look at different distributional arguments of fairness. So you could, given the huge racial disparities that are in stark relief with COVID that you showed us, like the graphs and talked about so eloquently at the beginning of this talk, you could argue that the provider relief funds to hospitals should have prioritized the safety net hospitals, and especially those hospitals that are located in communities that are disproportionately, have residents, Black and brown residents, or hospitals that have a disproportionate patient base that take care of Black and brown patients. And so, I don't know if you saw the article in the New York Times yesterday about the safety net hospital in Los Angeles that was just heart-wrenching. But so for me, I read that story and thought, this is a one story that's told really well, but an example of what's happening across the country. So a very long-winded question, but what I'm getting at is, I wonder if there's a way, so when we talked before about which policies do you choose to see if there's a racial effect. And so I wonder if another way to think about it is, did some states actually pass policies that were focused on the disproportionate impact of COVID on communities of color? And what are those policies? I don't know. I'm just right. Maybe nobody did, and so there's no policy there. But there was an opportunity for states to do this, and there was an opportunity for the federal government to do it. It didn't do it. I mean, it gave the most financially well-off hospitals more money. Actually, it was the opposite of what you would hope if you care about racial equity and health equity. But I don't know. Just kind of throwing that out there. If you have any thoughts about that, but it's not. It allows you then to say, states could have taken different positions and some states did, and what explains that?
Yeah. This is great. And there's never a time that I engage with you, Colleen, that I don't walk away feeling like my brain is like firing on all cylinders. And I really appreciate this question for two reasons. One is, and at some point I may circle back to you about this, is that I have a completely separate paper I'm working on that's not sort of ready to talk about yet. But what I'm doing in that paper is taking a kind of historical view of the relationship between public policies around subsidizing and providing resources to hospitals and race, right? So that's but it's historical, it's not contemporary, so it's not COVID related, but it's been striking to me as I've delved into to some of the historical work on this and some of the historical and archival data that I'm looking at, just to see the long history of sort of underfunding and undervaluing medical establishments that disproportionately serve Black and brown communities in this country, especially in cities, and so I'm really happy to hear that you're working on that paper, and it's, I'm certainly with you in terms of thinking about that. But I love that you connected it to this work. And part of what I hear you asking is about something that I've been thinking about adding to this is, what were the policies that were specifically about racial inequity and addressing racial inequity, right? It's a little hard because they don't fall into a policy arena this way. They're sort of scattered all over the place. And one thing I've been grappling with is how to systematically identify them, right? And some of it is you could go in the LexisNexis state policy database and see policies that mention inequity or mention race and so I've started to sort of do that, and it's still pretty hard. I mean, the benefit of this being 1 year is that at least I can sort of wrangle the data. The downside is that obviously it's limited, the conclusions that I can draw based on it. But even descriptively, just knowing how many such policies are out there, and compared to the kind of the policies that I'm looking at that are very much help everyone policies, right? help everyone, but you'll often disproportionately help people of color, but that's not the framing necessarily, versus the policies that are much more keyed in towards addressing or reducing racial disparities. And maybe those are the policies where I'll see different dynamics, and where some of these racial political factors will kind of turn out to be more relevant. That's a really great question. It's certainly something that's on my mind, and it's something that, so long as I can manage to collect that data, that I will absolutely incorporate, because I think it's really quite important, right?
Yeah, I mean, just, with so many, mayors in major cities talked about how, like Mayor Lori Lightfoot here, when the data first came out, way back in April, of the disproportionate levels of COVID cases and deaths very early on, but she said, this is just devastating and unacceptable, right? So you had so many politicians saying this, and yet then the question is, okay, so what was the policy response? So anyway, I love it. I think that would be, even just as you said, descriptive, to see, did any cities actually do a more targeted, racially targeted approach? Yeah. So let's see, are there questions I'm missing?
I see one more by Mara, who I think is following up on the criminal justice piece. And I will just say, I can answer that in like 30 seconds and say, I am actually incorporating some of that information, right? So about, health policy responses in prisons in particular. And so, yes, I think that's a great example of where two separate domains intersect, and is really interesting for that reason. And so it's kind of going to be a separate piece, because it's neither purely criminal legal or purely health. It's kind of both, and we'll see where that goes. But I appreciate that question.
Well, that's great. I'm really excited you're doing the subsidy work, the historical work. I'll have to have you come back again and talk about that.
Yeah, it's actually hard in many ways, just to see how long we've been making some of the mistakes that we're still making now, and which is what I thought when I read the New York Times piece, like, wow, we have been doing this since the 1940s. And certainly, even after civil rights in the 60s, and Medicare and Medicaid, which, like, Medicare played a huge role in desegregating hospitals, but it was just, anyway, so I was very much convinced that a kind of longer view on this would help us to understand better what was happening now, which is part of what motivated that work. So I will happily circle back to you for your insights when it's ready, because it's still a space I'm learning a lot in.
Oh, I mean, I would circle back just to send me the work, if anything, because it sounds really interesting. So I don't know, if nobody else has any questions, I guess we could bring it to a close. Any final thoughts? I think you've shared so much with us, and I really appreciate it. I think everybody else does too.
Oh yeah, I appreciate everyone who's taken the time to be here. And the questions actually sparked a lot of thinking for me. And because it's one of the reasons why, even though sometimes presenting early work, you're like nervous, like, I hope people know this isn't the final product. But I always feel at the end like it was worthwhile, because I leave with ideas that are going to make the work better. So thank you to everyone who gave me.
It didn't feel, I appreciate that you presented work in progress, but it felt very well thought out. So
Thank you.
All right, well, thank you so much, Jamila. Thanks for everybody that came to join today, and we'll talk soon.
Yeah, take care. Bye.
Okay, bye.